So we're at the top of the hour. We'll go ahead and get started. Today's session, as I mentioned, is Building Skills for Cross-Cultural Communication and Resilience. This is part 2 of a series that is being presented by Mr. Joel Jackson. We are thrilled to have him here with us again. I'm just going to go through a couple of intro slides, the disclaimer, which is that we are about to share opinions, content, and views that do not necessarily reflect those of the Center for Mental Health Services, Substance Abuse Mental Health Services Administration, or the U.S. Department of Health and Human Services. As mentioned, this webinar is being recorded and archived and will be available on our website. Importantly, the SAMHSA-funded Mental Health Technology Transfer Center Network uses affirming, respectful, and recovery-oriented language in all activities. Here you see some examples of language that we strive to use. For example, we strive to use language that is strength-based and hopeful, that's non-judgmental and avoids assumption, that's respectful, clear, and understandable, that is inclusive and accepting of diverse cultures, genders, perspectives, and experiences, that's healing-centered and trauma-responsive, consistent with our actions, policies, and products, respectful, clear, and understandable, and that we invite individuals to participate in their own journey. So we invite you, as you place comments in the comment box and questions in the question box, to also please feel free to follow these recovery-oriented language as well. So for those of you who might be new to the Mental Health Technology Transfer Center model, what you see here is a map of the United States that is separated by region. We are Region 9, which is the green region in the bottom left-hand part of the United States. We provide training and technical assistance to the mental health workforce of California, Nevada, Arizona, Hawaii, and the U.S. jurisdictions of the Pacific Islands. In addition to the Mental Health Technology Transfer Center, there's also an Addiction Treatment Technology Transfer Center and a Prevention Treatment Technology Center that are also represented here on this map. And then finally, there are 2 population-specific MHTTCs. There's one for the Alaskan Native and American Indian community and one for the Hispanic Latino community as well. Our role, as I mentioned, we offer training and technical assistance as well as resource dissemination that supports the mental health workforce to adopt and effectively implement evidence-based practices across the mental health continuum of care. Our goal is to promote evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies that strengthen and sustain the mental health workforce. Here are some of the services that we provide, webinars such as today. We also have a newsletter. At the end of our slides, we have information if you'd like to get connected to our newsletter or learn about any of our online courses or affinity group learning, individual coaching, regional trainings, tools that we provide on our website, and also individual consultation. We do welcome you reaching out to us. And without further ado, it is my honor and pleasure to introduce to you our colleague, Mr. Joel Jackson. He is the Assistant Director of Inclusion and Training at the Urban Health Institute, the Diversity, Inclusion, and Equity Department of the University of Chicago Medicine. Mr. Jackson serves as a subject matter expert for several programs at the Chicago Center for HIV Elimination. Through Truth, Racial Healing, and Transformation of Greater Chicago, Mr. Jackson serves as a racial healing practitioner. In this role, he co-facilitates racial healing circles across Chicagoland, helping to provide space for healing and connection and to reaffirm the humanity in all of us. He is also the University of Chicago Medicine Assistant Director of Inclusion and Training for the Urban Health Initiative Office of Diversity, Inclusion, and Equity. He coordinates the hospital's cultural competence training strategy and is the lead facilitator of the University of Chicago Medicine Cultural Competence course. Mr. Jackson is also helping to coordinate the hospital's resilience-based care training strategy, which will include a focus on compassion fatigue, resilience, and a focus on trauma-informed care. He is a certified compassion fatigue professional and the 2020 Staff Diversity Leadership Award recipient for the University of Chicago. Without further ado, Please welcome Mr. Joel Jackson, who is back by popular demand after the first part of this session over the summer. Welcome, Mr. Jackson. Glad that you're here.
Thank you, Eliana. Thank you all for attending today, and thank you for having me back to present part 2 of cross-cultural communication. So as I begin, I just want to go over the agenda. I'll first go over some norms and objectives. We'll do a quick review of cross-cultural communication part 1, just in case there were some participants today that weren't able to attend the first part, and also to remind those who did attend the first part some of the things we discussed in part 1. We'll also go over the ladders of oppression and the ladder of cultural competence. I'm going to go over the iceberg model and also visit the dominant culture system of sex and gender. I will also remind to some and teach to others the Clara method. Then we will watch a video called Ouch, That Stereotype Hurts. And then we will also have some time at the end for questions and answers. So our objectives for today, we're going to look at definitions related to stereotypes, bias, and oppression. I'm going to describe the ladder of oppression because in part 1, I described the ladder of cultural competence. I'll go over both of them though today. And the video will actually help us to learn skills for interrupting bias, stereotypes, and derogatory remarks or jokes. So like before, I like to use the PRIDE acronym for our operating agreement. And after I'm done going over the steps for the operating agreement, if you agree, then you can use the reaction button at the top left corner of the Adobe Connect system to say whether or not you agree. All right, so the P stands for participation. All that I ask is you do your best to eliminate distractions and do your best to stay present on the topics at hand. I understand that this is remote, virtual, and many of us are in our own home settings, and there could be quite a few things going on, but just try your best to stay as attentive as possible. R is for respect, so I want us to actively listen and try to demonstrate that you hear by responding when I ask questions. You'll get opportunities to give feedback or comments in the comment box, and feel free to also ask questions. And if you ask questions as the presentation is going, we will reserve those questions to the end so that I can make sure that I answer as many as I possibly can. And then also trust the process. Try to stick with me until the end. I is for integrity. So if you hear something that doesn't vibe very well with you, try to assume best intentions. That can help with the dialogue. D is for diversity. So we want to remain open to learning, even if we hear ideas that are different from our own. It's also an opportunity for us to work on suspending judgment. Judgment is something that we all do. We can't navigate our way through the world without judging differences. At the same time, when we have opportunities like this, I say we can use our filters. Everything that comes up into the head does not have to come out through the mouth. We can be intentional about what we say. And then lastly, the E stands for excellence. And what I ask is that you sort of gently lean into discomfort. When you are in your comfort zone, there's nothing pressing you to learn anything new. At the same time, through this session, we will be doing you'll be presented with information, we'll be doing some activities that'll hopefully stretch you sort of away from your comfort zone to rest snugly at what I like to call the learning edge. The purpose of this operating agreement is to sort of build a container around the experience so that no one feels fear or threat, and that we can then engage in the presentation in a way that helps us learn something new. Because when I feel fear or threat, I naturally retreat back to my comfort zone where no new learning can take place. So if I have your agreement to these norms as stated, you can simply select the agree button in the Adobe Connect. Thank you, Bethany. Thank you, Carla. Thank you, Heather. And if you have a hard time finding what I'm talking about in terms of how to agree, how about we do this? If you disagree with any of the operating agreement, please speak now or forever hold your peace. Okay, we'll move forward. So in part one, I talked about the ladder of cultural competence. Sometimes when the term cultural competence is used, there's a tendency to want to focus on others, meaning what can I learn perhaps about this identity group from this cultural perspective or this religious perspective so that I can work better with people from that perspective. Well, it's actually more important to start with self. And so the first rung of the ladder of cultural competence is focused on awareness. And as you can see, it says develop self-awareness, own our assumptions, values, and biases about human behavior. What that means is that each one of us has to introspectively think about what has influenced our belief system over our lifetime. What did we learn from our family members? What did our parents, who are our very first best teachers, or our guardians, teach us? What did we hear our extended relatives or our grandparents say, regardless of whether we agreed with them or not? When we think about our education system, especially the history classes that we took, whose story did we hear? Did we ever hear her story, for example? And were there certain he's who got to tell their story? When we interact with the media, from the movies that we attend, the TV shows that we watch, the articles that we read, the internet sites that we look up, even the lyrics of the music that we listen to can have an impact on how I interact with individuals who I have similarities with and the way that I interact with individuals whom I have differences with. The second rung is focused on worldview, and it states understand our worldview as well as the worldview of culturally diverse patients and coworkers. Essentially, what that means is that each of us has our own way of making sense of the world. And if there are about, 51 people on this webinar right now, then that means there are 51 different worldview perspectives. That means that I can't make any assumptions about you because I happen to have read a book or attended a cultural event that includes a piece of your identity. That means I also cannot make any assumptions about you just because we have similar identities, because we have a lifetime of experiences that are different that lend to the fact that we're always sort of negotiating our worldview differences. That's why the third rung is focused on skills. As you can see, developing appropriate interventions and techniques. Essentially, what are the skills that we need to have in order to operate in a cross-cultural environment like our own, right? And this is also one of the reasons I tend to use the term cultural competence, which I include cultural humility in the way that I define cultural competence, but because we can actually practice skills at enhancing our cross-cultural communication, that means that there is a certain level of competence that we can master when we practice these skills. And then lastly, the fourth rung is focused on systems. And as you can see, it states understand the institutional forces that support or negate cultural competence, which means paying attention to all of the things that we may not have direct control over to change, but still may very well have an influence on our ability to offer a culturally competent system of care. So for example, if I am working with a patient and discussing follow-up visits so that they can come into my office perhaps to meet with me, I may need to ask them how will they get back and forth between the office and their home, because if they have transportation concerns, then maybe helping them to tap into some social service programs or speak to a social worker would help for them to be able to make it to their follow-up appointments. That's a systemic thing, right? Also paying attention to if they're on public transportation, will public transportation facilitate their ability to make it to appointments, things like that. And so these arrows represent the fact that we work on all four levels of the ladder of cultural competence at the same time in order to effectively work towards a culturally competent system of care. So here's the definition of worldview, which I went over also in part 1. The way you frame the world and what it means to you, one's conceptual framework, how you think the world works, and your philosophy of life. Again, it's just the way that you make sense of the world according to the way you were socialized to think about things, which brings me to the cycle of socialization. All of us were born into the world, and these mechanics were already in place. These systems of oppression and these institutions were already in place. And so there's no shame, blame, or guilt on any of us because we didn't create these systems. And we also didn't get to choose our identities. We kind of plopped into the world, and all of that was already in place. And for most of us, our identities are fixed, though certain identities can shift somewhat over time. As we grow and learn, we are then socialized, and we're socialized according to the identities that we hold, which means that we receive rewards for some identities just because we're a part of that identity group, and we receive sanctions as well for some of our identities simply just because we're a part of that identity group also. I don't remember if I shared examples with you all in part 1, but just to give a quick couple of examples, I can remember the male sports teams when I was in high school receiving more notoriety, attention, and resources than the female sports teams. That's an example of a reward that male athletes receive just from being male athletes, and a sanction that female athletes receive just for being female athletes, just to give you a quick example. And so again, how we are socialized and how we make sense of the world lends to how we come to understand the world and how it works. As I move through today's presentation, it's important that we keep in mind the concept of intersectionality, which was coined by Kimberly Crenshaw, which essentially means that we do not exist as single identities. We all exist as multiple identities and roles, and our lifetime of experiences also is included within our dimensions of diversity. So as you can see here, a person's individual experiences are impacted by their simultaneous memberships in different social groups such as race, class, gender, religion, sexual orientation, etc. The intersecting identities impact one's access to resources and ability to live a healthy and productive life. Again, we are all members of many groups at the same time, hence multiple identities. So let's get into talking a bit about some of these definitions. The definition of stereotype that I'm working from is an oversimplified image or statement applied to a whole group of people without regard for the individual. And if you look at the image, you will see several individuals holding up signs that perhaps pertain to stereotypes regarding these individuals. The last image says, "I am a person, so I must be stereotyped," meaning that we all belong to groups that have been stereotyped, so this is something that has happened to all of us. Which brings me to the definition of bias or prejudice. As you can see, it states bias is a predisposition to see events, people, or items in a positive or negative way. Bias is an attitude or belief. Okay, you may have heard of the term implicit bias, or you may have heard unconscious bias. That's in reference to the biases that we may hold that we may not be aware of the fact that we hold them. In session 1, we did a visualization exercise to help us explore bias and explore how stereotypes that we may have heard or learned over our lifetime may have an impact on how we make sense of the world, hence influence our biases that we may hold. And at the end of the activity, we did do some polling, and hopefully what it taught us all is the fact that bias is inevitable. We all have bias, even those of us who would like to think we do not have a biased bone in our bodies, simply because bias is based on our very limited amount of experience living in the world. And therefore, because of each of us have a limited amount of experience, that means that we have some biases. There are some things we have not been exposed to, and there are some things that we've been exposed to, but in a way that adds value or judgment, and hence can facilitate our bias. Here are some examples which I shared in part 1 related to COVID-19. Racism and stereotypes specifically towards Chinese and Asian Americans, especially as COVID-19 in the beginning or the onset of our learning more about it. And there were certain terms used like Wuhan flu, Asian disease, Chinese coronavirus, terms that were very stereotypical and somewhat biased towards Chinese and Asian Americans. And some of the influence that that had is that many of my colleagues who are Asian in descent talked about how they were wearing masks even long before it became sort of a norm for everyone to wear masks, simply because they were trying to combat any of the stereotypes that others would have or bias that others would have towards them. There's also the example of age and how it impacted many of our elders, and therefore was seen as leading to an outbreak of age discrimination, and certain terms like boomer remover were used in reference to COVID-19, just to give a couple of examples. So what we're actually doing is talking about this ladder of oppression, and I already talked about the first 2 rungs, stereotype and bias or prejudice. Now notice that stereotypes and bias, they occur on the individual and intrapersonal level, meaning that they happen inside of me. I explain it plainly by saying stereotypes, again, are those things that I heard or learned that are in my head. Bias and prejudice, those are the attitudes that I have towards difference and similarities that I have in my heart, and the beliefs that I have about those differences and similarities. But when we start to operate on the group level, this is when we actually may discriminate against others. And this is on the interpersonal level. Now, if you've ever heard of the term reverse discrimination, there really is no need for it, because discrimination can occur in any direction on the group level. So think about perhaps eating a meal in a cafeteria and reserving seats for particular groups. As a person of color, I could discriminate against white colleagues and say they can't sit with me. As an openly gay man, I could also discriminate against perceived heterosexual colleagues and say they can't sit with me either, right? That's an example of a group level form of discrimination. But when we're talking about this 4th rung, we're talking about oppression, which is that one-way systemic mistreatment of a whole group of people just based on their social group membership. And this is reinforced institutionally, culturally, and societally within our country. And one of the limitations of the presentation is that I am focusing on how these dynamics manifest within the United States. Now, that doesn't mean we can't allow for more of a global conversation around these issues. At the same time, the dynamics may look a little different when we travel outside of this country and go to other countries. So this brings us to the full definition of oppression, which is a system that maintains advantage and disadvantage based on social group membership and operates intentionally and unintentionally on all of these levels. So on the individual level, that's the stereotypes and biases, which is represented by internal thoughts, feelings, beliefs, and perceptions represented by stereotypes and biases. On the group level, this is attitudes and actions that reflect prejudice or unfair treatment against an individual or a social group. But on the societal, cultural, and mainstream level, this is represented by social norms, roles, rituals, language, music, and art that reflects and reinforces the belief that one social group is superior than another. To give you an example, think about sexism and how it's widely accepted in media and in music videos, for example, to objectify women's bodies, or even to use the bitch term, which we know is often used as a derogatory term in reference to women. Another example is how in some parts of the world, in our country, especially maybe about 10 years ago, it was normal for people to say terms like "that's so gay," or for a man to give a compliment. And actually, someone actually just did this to me yesterday. They complimented me on my haircut, but then also said "no homo," as if it was acceptable for them to say something like that to me, to try to express that it wasn't sexual or same-sex oriented in nature. Those are examples of societal, cultural, and mainstream level oppression. When we talk about the institutional or systemic level, this is represented by policies, laws, rules, norms, and customs enacted by organizations and institutions that disadvantage some groups and benefit others. So an example of this could be thinking about areas within our country that may have food deserts because of a lack of perhaps zoning laws that limit the amount of fast food restaurants or require perhaps quality grocery stores to exist within certain neighborhoods. And then that can impact our ability to serve patients, and especially if we're thinking about nutrition needs and things like that. Because if a person has to travel more than a mile to get to a quality grocery store, they live in a food desert, which can impact what they have access to. And if all they have access to are corner stores and fast food restaurants, you can see how that can then lead to perhaps health disparities. And then lastly, oppression can take many forms: ageism, sizeism, racism, sexism, heterosexism. And because I work in the field of cultural competence, I reserve the right to put ism behind any term to make it a term of oppression. You may not see it in Webster's dictionary, but you'll understand it the way I explain it. And so thinking about the current climate in our society with a lot of the civil unrest and uprising, there is a new narrative sort of being depicted here. There's an emerging mass activating collectively against racism, transphobia, misogyny, anti-Asian sentiment, homophobia, Islamophobia, anti-Semitism, etc. And it's challenging comfortable notions of what it means to be an ally. And it's actually expanding it, especially if we think about the concept of intersectionality. The reality is that we are all each other's allies because every dialogue we engage in is cross-cultural. So that really reframes the thought of and definition of allyship. This also includes fear and fatigue of what anti-racism and justice work might look like for you personally. Whether that means engaging in deliberate conversations with colleagues at work to explore some of these ideas or concepts, or even thinking about how this may impact the patients that you serve, especially as mental health providers. In addition, fatigue experienced by historically marginalized individuals who haven't had the opportunity to perhaps rest and who may feel fatigued by a lifetime of dealing with these issues. So here you can see both of the ladders next to each other, and the reason that is here is so that you can actually see that for each level of the ladder of oppression, there is something that we actively can do on the ladder of cultural competence to combat the ladder of oppression. In fact, we have to intentionally climb the ladder of cultural competence, because if I am not climbing the ladder of cultural competence, then I kind of fall off and land on sort of the escalator of oppression. Meaning that if I'm not intentional about being culturally competent, my default will be to actually help propel the ladder of oppression. So let's look at the iceberg model. Oftentimes when I use the iceberg model, some of the first things people think about are the movie Titanic, right? And being on a ship and only being able to see what's at the tip of the iceberg. Well, that's true. If we were on the surface of the water, we would only see what's at the tip of the iceberg. And what's at the tip of the iceberg as we think about worldview and culture is what is expressed as behavior, right? This is the things that we see only on the surface. So for example, If someone were to enter the room that you are in right now and they see you, they will already know that you are attending perhaps a webinar or a presentation just by the behavior that they observe. They will see and notice that your attention is on your screen. They may hear me discussing things and see me advancing slides so that they would know exactly what's happening just from entering the room. In fact, I work inside a hospital, and if I were to walk around in the halls, I will definitely notice that I'm in a hospital setting or a healthcare setting, because I may hear codes being called off on the intercom. I'll see individuals walking around wearing scrubs and stethoscopes, and I also know that I'm in a professional setting because all of the colleagues will be wearing a badge to show that they are formally a part of the organization. These are all things that are expressed as behavior that are at the tip of the iceberg. At the same time, underneath the surface is this much larger mass of the iceberg, which represents the things that we have learned over our lifetime and that are largely in our subconscious, meaning that we don't think about these things all the time, and that there's not much conflict for us to act according to our values or our morals, which are some of the things that are underneath the surface of our iceberg. One moment, I need a drink of water. So, to help bring this home just a little bit, we're going to explore the dominant culture system of sex and gender. I'm going to ask you a bunch of questions. Feel free to use the chat box or the comment box to put in answers to the questions that I'm going to ask you. And trust me, you will know the answers to these questions because all of us have been socialized according to the dominant culture system of sex, gender, and sexual orientation. So, when a baby is born into the world and the doctor takes a very cursory view of the baby, they usually announce what? Put in the chat box your answer. What do they usually announce once they see? Right, so they may announce it's a boy or it's a girl. Thank you. The sex, right. How do they know if it's a boy? Okay, the genitals, right. And what it's specific, it's okay, this is an educational setting. You can be clear what genitals. Thank you, Danielle. Thank you, Ron. They will notice that it's a boy because the baby will have a penis. And then that baby will be assigned what sex? Male. Thank you. Now, I see some of you are also answering for a girl, right? So if they announce that it's a girl, that's because that baby has a vagina, as I see Melanie and Vanuet. Hopefully I spelled or pronounced your name right. You said. And then that baby is assigned the sex female. Good. Thank you. So this is sex, all right? Which is in reference to biology, anatomy, the biological makeup. But to take this a little bit further, if a baby is born with a penis, assigned the sex male, and that baby is expected to act like a what? Act like a boy, right? And grow older and act like a man, right? And behave in what manner? Masculine. Thank you. See, I knew you all were going to know the answers to these questions, right? Let's take it a little further. If a baby is born with a vagina assigned the sex female, then she is expected to act like a what? A girl, and grow older and act like a woman. Thank you. And thank you, Nancy. Regardless of her age, she is always expected to act like a lady and behave in what manner? Thank you, Kashina. Feminine. So this is gender, okay? So, for just to pause for a quick moment, oftentimes in our society, we use sex and gender synonymously. In reality, they are two very different things. To explain it plainly, I usually say sex is between my legs, gender is between my ears. Okay? So sex is only about my biological makeup, my anatomy. Gender is how I see myself as a man, woman, or transgender individual, and how I expect others to see me as a man, woman, or transgender individual. Right? Physiology versus identity. Thank you. And just as a teachable moment, anyone that falls into this dynamic, this system, that they were born with a penis, assigned to sex male, identify as a man and behave masculine, or born with a vagina, assigned to sex female, identify as a woman, behave femininely, you are considered within the cisgender umbrella. So when you think about the prefix trans versus the prefix cis, cis-Atlantic, transatlantic, identifying within the gender role norm, you are cisgender. And this term was created by a transgender man from the Netherlands so that we would have language to identify cisgender individuals without being derogatory towards transgender individuals. So we can say things, we can ask questions like, is he a cisgender man or a transgender man? Versus saying, is he a transgender man or a real man? Or is she a transgender woman or a biological woman, right? Because to say real or biological means that there's something wrong or awkward or weird about being transgender. So now you have new language where we can say cisgender versus real woman or real man. Okay? But to take it a little bit further, I'm not saying necessarily fifth gender, though. Hold on to that real quick for one moment. We'll get to that in just a moment, okay? All right, so to take it a little bit further, if a baby is born with a penis, assigned to sex male, expected to act like a man and behave masculine for sexual orientation, he's expected to be attracted to whom? Yes, expected to be attracted to women. And if a baby's born with a vagina, assigned to sex female, expected to act like a lady and behave femininely, she's expected to be attracted to men. Right. This is sexual orientation. Now, there are 4 rules that go along with this system. And even though we maybe were not directly taught these rules are definitely associated with this dominant culture system of sex and gender that lives beneath the surface of our icebergs. The first rule is that all the traits are locked together. There is no mix and match, which means that once you're born at the top, you go all the way across the top. Once you're born at the bottom, you go all the way across the bottom. Okay? The second rule, you must be one or the other, not neither and not both. And the third rule, you cannot choose which one to be or change from one to another. So, according to these rules, who is left out of the dominant culture system of sex, gender, and sexual orientation? Who's missing? And you can put your answers in the chat box. When you think about sex, when you think about gender, and when you think about sexual orientation, who is not included in the dominant culture system? So yes, if you identify as lesbian, gay, bisexual, or transgender, you're not included. Yes, anyone who veers from these concepts, or everybody, yes. So again, thank you. Someone said asexual, right? So an asexual person does form meaningful relationships, but they may not sexualize these feelings. This also excludes anyone who questions their sexual orientation or gender identity at any point during their lives, because you're not supposed to question it. You're supposed to know it and just sort of live that way. When it comes to gender, absolutely. Thank you, Michelle. Anybody who is gender fluid is excluded from this system. And then when we think about sex, who's excluded from the system when it comes to sex? Right. Okay. Thank you. So, intersex is the term we currently use for people who are born perhaps with ambiguous genitalia, meaning when the doctor takes a cursory view, they can't say it's a boy or a girl because maybe they have external genitalia of both male and female. But an individual can also be born with external genitalia of one sex and internal genitalia of the other sex. In addition, a person can be born perhaps with the internal and external genitalia of one sex, but on the chromosome level have chromosomes of both sexes. So there are many variations of individuals who are born naturally in society with both as intersex, actually. In fact, if you Google it, you can find that there's a whole movement of individuals that are who are trying to impress upon parents to not intervene at the early stages of right after birth and choose the sex of the baby, but allow the child to develop on their own. Because imagine what that would be like if you were being raised as one sex, but then when you hit puberty, the biological clock thinks otherwise, and puberty is already confusing for us as it is, let alone being additionally confusing for someone who was raised as one sex but then are developing secondary sex characteristics of the other sex. So, when we think about gender, though, this includes anybody who identifies outside of the cisgender umbrella. In fact, there are consequences of this for all of us, because I don't know anyone who's so hyper masculine that they never exhibit any feminine traits, and I also don't know anyone who's so hyper feminine that they never exhibit any masculine traits. In fact, a mother once told me that she considers herself a very feminine woman, a lady in fact, but if one of her children became in danger, then you would see her behave in a way that may be more associated with being masculine. Just to share sort of an example that someone shared with me. And then the last rule of this binary system is that male is better, which means that this system reinforces sexism, it reinforces transgender oppression, it reinforces heterosexism as well. Just to prove it, and because we are in an educational setting, you can feel free to be as expressive and clear with your answers as possible. But think about it and answer the question. What names are men called when they step outside of the act like a masculine box? Sissy. What else? The BITCH term. I'll just say it. They're called bitch. They're called a pussy. They're called a girl. They're called a fag or faggot. You know, and I'm sure you all can continue to go on and on and on, but think about it. These are all terms associated with being gay or being a woman, a girl, or feminine. You know, they're called weak. They're called punk. They're called crybaby. They're called mama's boys. You know, all of these terms to sort of push them back into the act like a masculine box. The same thing happens for women. What are terms that women get called when they step outside of the femininity box? Tomboy, butch, or bitch. A powerful man is called a boss. A powerful woman gets called a bitch. Domineering, or even lesbian or lesbo, right? Terms yet again that are focused on being part of the lesbian community, or terms that push them back into the box of femininity if they become too powerful, the same way that a man has power. Yeah, aggressive, controlling, not assertive, but aggressive, right? So again, the reason we did this activity was really to explore the concept of the iceberg model. And the fact that within our worldview, the way we are raised, we are, or socialized, I should say, lends to having biases that can then facilitate our behavior when we're interacting with others on the group level or making decisions on the systemic level. So what do you think about this quote? You don't have to answer this, but just rhetorically think. What do you think about this quote? We behave rationally in accordance with what we know to be true. Well, this is true. We do tend to behave rationally in accordance with what we know to be true. The issue is that when you're behaving one way that you think is rational, that's different from the way that I'm behaving that I think is rational, therein can lie the dilemma. So, for example, let's imagine that I all of a sudden get a phone call and I answer it while I'm on this Zoom, while I'm on this webinar, because I see that it's an important phone call from perhaps a family member. And then after I get off of the phone, I say, actually, everybody, I'm just going to end this right now. Cars, you can keep the check. I don't want any money from you. Deuces, good day. And I slam my laptop and I leave. If you attended the first session, you'd probably be like, wow, what happened? Like, I wonder what kind of phone call he got. Joel was very unprofessional this time. He didn't do that the last time. He was nothing like that. I don't understand, right? And then somewhere you may click on some news channel and see an announcement that Joel Jackson is the newest billionaire because he hit the lottery with his family in 5 different states. Then you may think, oh, okay, I get it. Now I see why he ended the session and he just left it completely, right? Another example of that could be, listen to me knocking on this table. This table is a wooden surface table, and you hear me knocking. You probably would say that this is a hard surface, okay? Well, it depends on your worldview, because if you all were, instead of mental health professionals, perhaps geologists attending a geology conference, you might say, no, Joel, that is not a hard surface that you're knocking on, especially if it's wood, because wood is actually considered very flimsy. If you want to talk about a hard substance, a hard rock, let's talk about the diamond, because that's the hardest rock that exists on the earth. Right? So again, behaving rationally in accordance with what we know to be true and based on our worldview. So I just want to remind some of us and to teach to others this CLARE method, which is a tool for cross-cultural communication. It comes from the nonviolent conflict resolution theory. So think about people like Martin Luther King, think about people like Dorothy Day or Gandhi, individuals who practice this tool during moments of real adversity. And so the idea is when I hear something that doesn't vibe very well within my iceberg, it can serve as a challenge to my worldview perspective. And when that happens, I may become reactive. I may say things that are not necessarily in line with my moral code or with my value system, right? So that's why the first step of the CLARE method is asking us to sort of find our center, calm ourselves, check your pulse, take a deep breath. Do whatever it is that you need to do to move from this sort of fight or flight response to regaining that neocortical function in the part of your brain that helps you think of consequences of your actions, helps you to problem solve, helps you to tap into compassion. If you plan to attend the resilience series that I'll be presenting next month, the very first one is going to focus on self-regulation, which is all about this very first step of the CLARE method. Techniques to use to find your center and calm yourself before you react and respond, so that you can make sure that you're intentional about your response and you're mastering this skill of CLARE method so that you can move forward according to your values and your moral code. So when we find our center, we're doing that so that we can better listen actively to the other person's perception of the problem. And again, you're listening to the words that are spoken, but you're also listening to the words that are not spoken. Oftentimes, a person can express their thoughts and their body language may express their feelings without them necessarily naming their emotions verbally. For example, if I'm upset and I'm going off and I'm very loud, I may not say, I am very upset right now because, I may just talk about what it is that made me upset without naming the emotion. But you would definitely be able to tell the emotion. The reason that we listen to the words that are spoken as well as the words that are not spoken is because the third step is to affirm some component of the speaker's perspective. And sometimes the only place for us to affirm could be within the emotion of the other person. Because affirming is sometimes the hardest part of this tool, it's easy for me to affirm someone when I agree with them. But this isn't about agreement. This is simply saying affirm some component of the speaker's perspective, which means that I am supposed to affirm you even when I disagree with you. And that can be very challenging to do, to affirm a piece of their perspective. Gandhi once said, everyone holds a piece of the truth. So in the spirit of compassion and teachings of compassion, then we should be able to affirm each other and sort of see each other's humanity or affirm a piece of the truth that each of us may hold, even if we disagree with the words that the person is saying. And then after following these first three steps, we can then respond to what was said and add information to the response in a way that moves the discussion forward. Now, you may be wondering why I spent so much time on the first three letters and hardly any time on the last two letters. Well, the reason is we tend to do these last two steps all the time. Someone says something, then I respond and add information, then they respond and add information, and before we know it, we're having an argument and we're not having a dialogue. I think it can be very helpful, especially when we're negotiating worldview differences. When I'm trying to understand a patient's, their understanding of their illness and how they expect their illness to be treated, right? Negotiating worldview differences using the Clara method can help with negotiating those worldview differences. There is one other part of this tool. It's also important, one moment. It's also important for us to not use the word but or fancy buts, like however, that said, nevertheless, because when we use those terms in making an affirmation, we kind of negate what we said previously. It may be better to use terms like and, in addition, also, or at the same time when making an affirmation. The difference is saying something like, I can imagine how you must feel that way, but if you could just suspend your iceberg and live in my iceberg where everything is perfect, then you'll have a perfect world as well. It doesn't work like that, right? Instead, think about saying things like, I can imagine how frustrated you must feel. At the same time, this is what I think is really happening and going on. It's not saying that what I have to say is better than what you have to say, or what you have to say is better than what I have to say. It's holding them both sort of at equal footing so that we can then engage in a dialogue and not necessarily an argument. So consider using the Clara method the next time you're engaging in discussion or you're just trying to negotiate worldview differences. It does take a lot of practice because it's not the normal way that we communicate with each other. And I do consider it really an exercise within your own spiritual gym, which means that it's not really about the other person and it's not about changing their beliefs, their opinions, or their mind. It's really about you and how you choose to show up during an encounter to maintain your character, your moral code, and your sense of integrity. And it will not necessarily always perfectly go CLARA complete. It may quite in fact go CLARARALCLALCCCCCCCCCC. because it's an exercise within your spiritual gym. And it's about you, not about the others. Okay, so that brings us now to this video called Ouch, That Stereotype Hurts. We are going to watch a component of the fuller video, and it will give you what I like to call soft skills on what to do in those situations and moments where you hear someone say something and you don't necessarily agree, or it makes you feel a little funny or different about what they said, but you may not necessarily know how to interrupt or what to say to address it, right? So it'll give you some skills on what to do so that you don't silently collude as if you're in agreement with what the other person has had to say. And then after you watch the video, we will come back for some discussion and allowing for the asking of questions.
Handicapped person, female, fat people, Muslims, white folk, racist, Christians.
Everyone knows men are good leaders.
Dumb blonde, what do you expect?
Very articulate for Puerto Rico. What would he know? He's just a 10.
Hispanics.
Try to Jew me down. Mexicans are
You people all look alike.
You people are all alike.
You people are all alike.
Person, female, Puerto Rican, Republican, Democrat, techie, disabled.
Why don't you learn to speak English?
Just speak English.
Speak English. What do you expect from a foreigner?
These people are terrorists.
I don't see you as black.
You're not like the others.
Gen Xers. They think they know everything. Typical Cuban.
Typical baby
You
boomer.
sound black on the phone.
Isn't that just like a man?
Ya tú sabes, isn't that just like a
How many
man?
blind men does it take? No, really. How many does it take?
Well, you really have to manage your expectations with those people.
He doesn't act Indian.
Too old,
White folk.
young, from operations.
Things were so much
from
better before you
headquarters.
Asians are
Just
smart.
a clerk.
Typical teenager. Shoplifters.
Indian.
Wow, you do that well for a handicapped person.
What a retard.
Typical white
Those
male.
people are so lazy.
I just don't see you as a black person. Those Christians are so
You
narrow.
know how she got her
Funny,
job.
you don't look gay.
She's not really Hispanic.
Woman.
She doesn't even
Girl.
speak Spanish.
You can't trust those people.
You leave
They lived next door once.
Don't want to speak.
My bike was stolen.
Narrow
Gay men make good decorators.
You're really good at that for a
They
woman.
are salesmen.
Americans are aggressive.
You know how
She
they
doesn't
are.
understand. She's too young.
How many lawyers
You can't trust them.
You people.
You people.
You people.
You're not like the rest of them. I get lots of cartoons and jokes by email, at home, and at work. Some are funny, I have to admit, but some are pretty over the line.
They were talking about Polish people.
Mexican jokes. Yeah, they're really funny.
I'd rather not get these, but I don't want people to think I'm a stick in the mud. They don't have a sense of humor.
And then the jokes just kept coming and everyone kept laughing. And little did they know I was listening in.
Everyone goes along with it.
Being part of the group is important to me.
He doesn't know where my family is from.
They hurt my feelings.
Because I didn't speak the language.
When I hear these jokes, I laugh. But inside, I'm really hurting.
A quote-unquote humorous remark. She made a statement about black people,
Hispanics.
Polak.
Gay.
About Jews that was really demeaning.
and I thought to myself, I'm not going to say anything, and I'll just see how far this clown goes.
My wife is Jewish.
Well, in retrospect, that was kind of a mistake, because he wasn't the only one.
I didn't say anything. I didn't want to hurt her feelings or embarrass her.
By the time that I felt like I really should say something, I couldn't, because for one thing, I felt about half sick, and for another thing, I was so angry that if I'd said anything, I'm afraid I would have sounded just as ugly as they did.
Lately, we have had some newer, younger employees in our department, and we joke about them too, and we make lots of comments about their work ethic. I don't think it helps anyone. It's almost like we're an exclusive club and they don't fit. I want to say something, but I don't speak up because I don't know how. And the last thing I want to do is to make things worse or to put people on the defensive.
Wow, you really have no accent for an Asian person.
After about 20 minutes of going over my job performance, he ended the review by saying, "I think you've done really well considering the hand you've been dealt."
I didn't know how to respond to something like that.
I didn't know how to respond to this, so I just said thanks.
I mean, I wish I would have said something because I found it really offensive.
I mean, he was my boss after all.
But I didn't want to say anything because she's a senior level manager.
He's very influential.
I really wanted the job.
I didn't say anything.
I didn't say anything.
I didn't know how to bring it up and not make a big deal out of it.
I don't want to be seen as a troublemaker.
I know she meant well, but
It really bothers me.
I was really offended.
It really hurt me.
I was at a party, relaxed, enjoying myself, when the joke telling began. There were three who went to you fill in the blanks. The joke progressed, and it was clearly demeaning to a group of people. The face of my close friend and colleague popped into my mind. He's part of the group being debased. Two different voices, the proverbial angel and devil on my shoulder, filled my head. Say something, you know you don't support this. Relax, it's a party, lighten up, have fun. People won't like you if you can't take a joke. This is no joke to me. Speak up, coward. In those long seconds while I twitched and struggled with what to do, the DJ, who was sitting with us on break, simply said, "Whoa, I'm not going there. I think I'd rather get something to drink." So he got up and walked across the room. I hopped up and followed him. Good idea. I'll never forget what happened next. Others in the group joined us at the bar, leaving only a few people to hear the joke's punchline. I was amazed. Few of us wanted to hear the joke, but we went along anyway. Just took one voice, one person casually speaking up against disrespect to shift the conversation. So how do you speak up against stereotypes and demeaning comments without putting somebody down? Well, there are lots of ways you can speak up, and we'll practice several of them. It's all in how you approach it. The key is to assume good intent. And that's our first technique for speaking up. Assume good intent and explain impact.
I know you mean well, but that hurts.
The important thing is to assume good intent. Approach the other person as if that person is a decent human being. When you assume the best, there's no need to blame, shame, or insult the person who just said something biased or demeaning. There are two parts to the technique. First, acknowledge the other person's positive intentions. Then describe the negative results of the statement or behavior. When you encounter stereotypes or other unfair depictions of people, ask a question. Choose a simple, non-blaming question such as, "What do you mean?" Or, "I'm sorry, what was that?"
What do you mean?
You can even practice these simple questions in advance. Remember, the key is to assume good intent, approaching the conversation as if the other person meant no harm. Questions are great because they're so easy to use and they open up conversation in a non-blaming way. Sincere and open-ended questions that avoid blaming the other person work best. And tone of voice is everything. Questions that are sarcastic or accuse the other person are not helpful. Interrupting and redirecting changes the direction of the conversation abruptly without requiring further discussion.
Whoa, let's not go down that path.
Interrupting and redirecting is simple, and it gives people a chance to change directions. If the disrespectful behavior continues, you can use one of the other techniques, such as assuming good intent and explaining impact. Or you can walk away, removing yourself from the situation. But the important thing is to not stay silent. Sometimes people attribute a common human behavior to only one group, and then they stereotype the whole group as if everyone in the group is identical. In this situation, you can broaden the description to humankind in general. That helps break through the stereotyping.
I don't think it's a gay thing. I mean, I think that applies to everyone.
This technique is powerful. You can show the attribute isn't just about the stereotyped group by suggesting that the trait is universal human behavior. So, you can break through stereotypes by showing how the so-called trait of the stereotyped group really applies to many different people. Or, you can use an opposite technique to break through the stereotypes. Instead of broadening to human nature, you can narrow the focus down to one individual. Often, people are clumped together in a stereotype. This approach, make it individual, breaks through that clumping. While the characteristic may be true of a few individuals, it's definitely not true of everyone in a group.
You mean all managers, or are you speaking of someone in particular?
Sometimes you don't have the energy, or you're too stunned to say something, or just can't think of what to say. Well, here's something easy that anyone can say. Ouch.
Ouch.
What do you say when someone unintentionally steps on your toe? Same thing here. Ouch communicates a lot with little effort. It says, your words had a negative impact on me, or on others that I care about. If you have the time and the energy, you can ouch and educate. Explain how the words affected you or others. Or you can simply say, ouch. It's a simple, effective, acceptable 4-letter word that carries a lot of meaning. And it puts a pause in the conversation, which gives everyone time to think about what is being said. Assume good intent and explain impact. Ask a question. Interrupt and redirect. Broaden to universal human behavior. Make it individual. Say ouch. So, we've seen several ways for responding to stereotypes and other demeaning comments. You can use these techniques one-on-one or within a group, in public or in private, at work or at home. You can use any one at any time. You can even come back later and address something that was said earlier. Some of the techniques will feel easier for you than others. Just choose the one or ones that are the most comfortable for you. You don't have to sit silent when you want to speak up. You have the skill to do so, and your voice will make a difference. So go ahead, say ouch when it hurts. You can speak up, effectively and with respect.
I know you mean well, but that hurt.
What do you mean?
Well, let's not go down that path.
I don't think it's a gay thing. I think that applies to everyone.
Do you mean all managers, or are you speaking of someone in particular?
Ouch.
Ouch.
Ouch. Ouch.
Ouch. Ouch.
Ouch.
So when we talk about being culturally competent, here's a few additional pearls of wisdom to consider. It means having a reflective eye and an open mind, which means spending time on that first rung of the ladder of cultural competence and exploring sort of your own level of self-awareness. It also means remembering that all of us hold ideas about different groups and cultures, meaning because we all have a limited amount of experience living in the world, it's inevitable for us to not have, it's inevitable we will have bias. The idea is to become more aware of our biases and to broaden our worldviews by exposing ourselves to difference so that we can try to keep our biases from having an impact on our interactions with others. It also means engaging in a deliberate and intentional process to examine our privilege, biases, and cultural misinformation. We might have to unlearn some things that we've been taught or socialized to believe, and we may have to explore what it means to have privilege, right? Because it's not helpful for me to feel guilty about the privilege that I have, because guilt, there's no room for guilt within the movement. Guilt immobilizes. Instead, it may be helpful for me to engage with others who have privilege or social power on the same levels that I have so that we can begin to think about how we can use our privilege for good to better help level the playing field. Being culturally competent also means remembering that self-awareness is a complex skill gained over time. You know, it means, again, deliberately exposing ourselves to difference. It means exploring our past associations and the things that we've been taught. It means exploring, you know, the things that we're used to and we're comfortable with. You know, if you were to think about the identity that you think of the most, that might be the identity that you're the most comfortable with. Or if you think of a social identity category that you express the least, like for me, I don't think a whole lot about ability because, one, I am able-bodied, right? And that may be the area where I may feel the least comfortable discussing when it comes to social identities. And then again, paying attention to feelings of guilt and shame. Because like I said already, there's no room for guilt or shame. None of us should feel guilty or shameful about the institutions, and guilt immobilizes. Instead, it's helpful to be able to better understand them and to understand where I have social power and influence to help make decisions that are more in line with cultural competence. In terms of the impact of cultural competence on, or training, I should say, on health outcomes, there isn't much research that neatly ties cultural competence training with healthcare professionals to improved health outcomes of patients. At the same time, from the National Academy of Medicine, this is ideally how it works. If we can enhance our communication with each other, with patients or clients, and with caregivers or family members, then we could perhaps help increase the level of satisfaction that patients have, because they'll be better able to understand what's expected of them, especially as they navigate through the healthcare system, especially also when they're following their own home health routines. And as they have a clear understanding of what's expected of them and how to follow their home health routines, that can lead to a better adherence to health routines, which then can lead to improved health outcomes. So that brings me to the end of the presentation content that I had for you all today. What questions do you have about anything that I discussed? I see the question from Laura, and you will get an answer for that in just a moment when Eliana or one of my other colleagues comes on to go over the last few slides and tidbits. At the same time, what questions do you have about any of the content that I covered today? Well, I will assume that either someone's typing and they haven't quite hit enter yet, or I did such a fabulous job with presenting that you have no questions, which is fine by me. I see somebody's typing. There's a couple people typing, so I'll pause and wait just a second. Oh, thank you, Danielle. I appreciate that. And thank you, Melanie. Thank you. Okay. I take compliments as well. If you don't have questions, you can feel free to give compliments. But at this time, I will turn it back over to my colleagues who will wrap up our session for today. Eliana, I think that means I'm giving it to you. And you're quite welcome, everyone.
Joel, can you hear me? Outstanding.
I can hear you.
Thank you so very much. I am always honored to learn from you, Joel. And I do actually have one question, which was, these days of 2020 are so intense. There are so many different challenges that are going on. I'm finding that in the moments when I need to use the Clara model the most, that my blood pressure is already a little bit high. I'm already feeling stress and tension from everything that's going on in the world. And I wonder, Joel, if you could share, in moments like that for you, when you're already kind of maxed out, what do you do to help yourself so that you can kind of make good on the Clara if that makes sense?
That's a very good question. That makes a lot of sense. So the good thing about the Clara method is that you can practice any of the steps of the Clara method without necessarily having to use the whole tool. So in a moment like that, when I'm stressed and I'm sort of operating out of my default mode and can't necessarily be intentional about what I say, then that is a moment for me to engage in just the first step of doing what I can to find my center and calm myself. And even if I have been in a situation where I was trying my best to calm myself, but I still couldn't because of all of the nervous tension that was already built up in me. In that situation, what I did instead of engaging the Clara method was use a delaying tactic by saying something like, I do want to engage in this discussion. At the same time, there's something that I have to take care of right now. So I'll come back, because one of the good things about the Clara method is it can be used as a tool for service recovery or recovery of the conversation as well. So using a delaying tactic can help me to have some space and some time between the initial interaction and re-engaging in the conversation. And the delaying tactic of, I'm sorry, I want to continue with this conversation, but there's something that I have to take care of right now. Anyone can use that, because what you have to take care of might be yourself in that moment, so that you can move forward in a way that's more in line with your moral code and your value system. So that's what I would do. I would try to use that as a delaying tactic. And there are moments when I feel that I should be using the Clara method and I don't, and I see the train wreck coming and it sure enough crashes. Even in those moments, I still can take a step back or a step away and then refocus and then come back and re-engage using the Clara method to help me be more in line with my values. I hope that answered
it. Did. That was fabulous. Thank you. And I'm a licensed clinical social worker, and I think about the moments when I've needed to use the Clara method with clients, and comparatively to when I need to use it with colleagues. And when I'm using it with clients, it's because I'm managing that extra level of clinical relationship and rapport that's so essential. But even in those moments, whether I'm doing one-to-one work with a client or especially when I'm doing a group-level intervention, I have to address these statements, these biases, because if I don't, other people in the environment can be injured as well. And so it's a dance, but I've found that the Clara method is absolutely essential to helping to negotiate those moments in clinical situations as much as with colleagues. So, gosh, I appreciate you so much. And I'm seeing some messages here also from Danielle, who says, Danielle is thinking of all the heated political conversations right now. Clara is a great alternative to abandoning the conversation.
Mm-hmm. And did you also see Michelle Langford's comment that she used the first step of the Clara method when responding to an email today, when she really wanted to rant but pulled back and kept it professional. So, it takes practice. And that's also why I thought it would be helpful to share the ouch video, because then it gave some additional sort of tactics that you could use, especially during those moments where you don't have the time or energy to engage in a full Clara method dialogue.
Absolutely. I really appreciated some of the kind of one-liners that were in that video. And I'm seeing also Christy is saying that the video was fabulous as well. And Melanie says, maybe not abandon it, but reassess and then re-engage from a better perspective. Absolutely. And that rings true.
I like that. I like how you...
Absolutely.
No, I was just saying I like how you reframed it, Melanie.
Absolutely. And what you said, Joel, about taking a moment, that we can take a moment to care for ourselves, and that is just as valid and as important. I really appreciate that, because for us as caregivers, from whatever discipline of mental health professional we come from, oftentimes we're so focused on caring for others, we forget that it is absolutely okay to care for ourselves, and in fact that's a type of professionalism. When we care for ourselves, then we can do a better job caring for others as well.
Absolutely.
I'd like to thank everyone who's been in this presentation and who contributed in the comments in the chat box. This was a really, I think, complex and powerful presentation, in part because people were so eager and willing to share their thoughts. In the beginning, when you were talking about different stereotypes with gender and assumptions that people make, that was really great to have that kind of contributions from them as well. If there's any last thoughts, we welcome them in the chat boxes here, the comments. And I see Melanie has said that I know these conversations can be difficult, but they are necessary to gain an understanding of the marginalized folks who suffer daily from these biases and such. That makes sense. And I appreciate also, Joel, what you were saying before about how with intersectionality, we all have social identities that are going to be in the privileged community and in disadvantaged spaces as well. And so that at any point in time, any of us could potentially be marginalized. In fact, you were just telling me about this the other day, Joel, is that even for somebody who is typically in the privileged community, at some point they were a child, and if they're lucky enough, at some point they might be an older adult. And those are two communities that are disadvantaged based on ageism.
Absolutely. In fact, age is when we first actually start to learn about oppression. You know, even though we may not have the language, we start learning about power when we're children.
That resonates so truly. I have a 6.5-year-old at home, and wow, is it powerful to hear how he's starting to process these power relations at a young age. That makes complete sense. I see, Joel, that you've pulled up another slide here for us. Oh, you didn't? Oh, okay.
No,
well, I see another slide that's wonderful. It says, please.
I did it by accident.
It says, please use the comment chat box. What is one action you will take as a result of this webinar? So we would invite anyone, if you want to share any of those actions that you would take as a result of this webinar. This is great. Christy says, I will remember to say ouch. I see many people are typing right now. Michelle, I'll try to use those fancy butts. Danielle says, speak up and share. Outstanding. And I'm going to commit to watching the ouch video at work with colleagues. So Nunit Allen says, and forgive me if I've mispronounced your name, be honest when dealing with someone and take their feelings into consideration. That is lovely. Absolutely. Gionda says, we are holding restorative circles for our staff, going to take back some of the information about the Claire method and Pride operating agreements. Outstanding. Joel, I think this is the part of your presentations that I get the most excited about, of thinking about the idea of the pebble in a pond and how what you share here can really ripple out as people take it back to their places of work. Melanie says, I will do more research.
Yeah, I agree.
And what lovely job you did also, Joel, talking about gender fluidity and terminology. And Melanie is going to take that terminology to better support people. Jill says that they've already shared the Pride agreement and fancy butts. Thank you. So without further ado, I'm going to take us through the last of our slides. Thank you all so much for sharing this feedback. And without further ado, thank you all so much for attending. We will keep an eye out, please, for the feedback survey. We really look forward to hearing your thoughts. It helps us to inform our work and to maintain our funding. So without further ado, thank you all very much for attending. And thank you, Joel Jackson. We look forward to our next meetings with you.